Hello, everyone, and welcome to another episode of Random Health-ish. I am your host, Dr. Gloria Stone Osbeck, and tonight we have a very special guest, Ms. Felicia Thomas. She is a chronic care management supervisor. So she's going to talk to us a little bit about managing some chronic conditions that our family and friends suffer on a regular basis. So please join me in welcoming Miss Felicia Thomas. Hey.
Hello. Hey.
Welcome. I'm so excited to have you on the show tonight. So start off by telling us a little bit about who you are and what you do.
So my name is Felicia. I live in Florida. I've been working in healthcare probably over the past 15 years, and recently I got into the public health aspect of healthcare. So I've been working in public health for about 2 years, and recently I became supervisor probably 6 months ago over the chronic care management department at the internal medicine pediatric office that I work at.
Wow.
I know.
So that's pretty awesome. So tell
Mhm.
us a little of some of the things that you kind of deal with on a day-to-day basis.
So, the chronic care management program is basically it's held at all primary care offices, and what it is a program for patients that are usually 65 and older that are Medicare recipients. So, what we usually do, we have in our program, we have about 1,600 patients that we provide services to, and these patients have two or more chronic illnesses and they're receiving Medicare benefits. So the patients that have two or more chronic illnesses, they last at least 12 months or longer. And what we try to do is form a plan of care so the patients aren't going in and out of the hospitals.
Yes. Okay, so I know one of those chronic conditions is diabetes. So
Mhm.
tell me a little bit about some of the things that you help your patients that suffer from diabetes with.
So we try to provide them with education. We try to make sure that they're coming to their 6-month follow-up with their primary care physician. We're making sure that we're reminding them to keep a log of their blood sugars. If their blood sugars are going over 100, we try to make sure that we are calling them, making sure that they are doing their insulin correctly, if they're knowing how to administer the insulin correctly, because you can administer your insulin in your thigh or your stomach, but one area gets more of the insulin than the other. So if you're not inserting your insulin right, then you're not going to get all of your medication.
Right.
So we try to make sure that they're educated on that, making sure that they're knowing that they need to eat a lot of times during the day so that their blood sugars can be at a quality level.
Yes. And a lot of people don't realize, of course, you have type 1 diabetes and then you have
Mhm.
type 2 diabetes. So can you tell us a little bit about the major differences between the two?
Type 1 diabetes is kind of like a pre-diabetes. It's for patients that are at the beginning stages of diabetes. Their numbers are ranging between 90 and kind of higher, but they're not as bad. And type 2 diabetes is it's kind of the chronic illness diabetes where you're having uncontrol of your blood sugars. Your blood sugars are ranging around 130 or higher. You're having health disparities. You're not monitoring it right. You're insulin dependent, so you're needing someone to make sure that you're injecting your insulin correctly because you don't have it under control.
Right. So that'll be like pre-diabetic and then, full-on diabetic. And then
Mm-hmm.
I think also too, type 1 diabetes is an autoimmune disease versus
Mm-hmm.
type 2 being an acquired
Correct.
disease. My mom suffers from type 2 diabetes, and if she's watching, I'm sorry for your business.
So you telling on your mom?
So she has type 2. What are some things that, I know you told me about how you guys create care plans for
Mhm.
the chronic conditions, what are some typical care plans that you create for diabetic patients?
So usually, when we create a care plan, that's for new enrollee patients that's coming into the program. And that care plan has their problems, their medications, and their chronic illnesses. So what we usually do is we try to focus on two of the chronic illnesses that they're not having control of. And we try to put in some interventions. Interventions is things that us as your care coordinator are going to do with you to make sure that you're living a quality life. And then we have some goals that we want you to work towards. So outside of the office, you're doing it at home. So when you come back in for your 6-month follow-up and when you're doing your A1C is below 7.0. So,
Oh,
so some things that we try to do is educate them on what is diabetes. We make sure that they're eating a low sodium diet. We make sure that they're exercising 120 minutes a week. We try to make sure that they're if their diabetes is not in control, we want to refer them to an endocrinologist so that
mhm.
he can do diabetes management and meal management.
Now, do you all have like a nutritionist in your practice as well, or do you typically kind of refer out for that?
We refer out. So we have a referral to a endocrinologist that we know, and at his office, he does diabetes management and he does nutrition for
Oh,
all the patients in
nice.
the practice. Yeah, so it's very beneficial for those patients.
One thing I thought was interesting is that most people who are diabetics, when they go to their medical doctor, they typically tell them that they can drink diet sodas versus being able to drink regular sodas. But to me, the diet sodas are worse than the regular
Yes,
sodas because of the, artificial
the
sugar and
sweeter.
stuff that they put in there.
And that's one thing that can spike up your glucose levels is
You're
the
right.
artificial sweeter. So yeah, I don't understand that also. I don't understand it either.
So we might have to put something together and have a little talk with the
Exactly.
nutritionists that have put this together because that is, I don't know, that's kind of crazy to me. But I'm not gonna get all into that tonight.
Yeah, right.
Another thing I noticed too is that most people who do suffer from at least type 2 diabetes, like you said, it always comes with another type of disorder as well. So
Mhm,
I do see a lot of clients that have diabetes plus high blood pressure. Um,
mhm.
so what are some typical things that you recommend for patients who do suffer from high blood pressure?
Keeping a blood pressure log, that's very important because when you're keeping a blood pressure log, you're seeing that the time of day that your blood pressure is becoming out of range. Because some people they can take their blood pressures in the morning and it's fine, but then certain times at the afternoon or nighttime they notice an increase in their blood pressures. So keeping a log is very important because when you call your chronic care coordinator, letting them know that you're at home and you know you're experiencing either a headache, dizziness from your blood pressure being too high, and you're not understanding what is going on. Because a lot of them will call and say, I took my medications, but my blood pressure is still high. So we ask you, okay, have you kept the log? And when you kept the log, what are your numbers ranging? And what time of day are you taking it? So sometimes they'll say, well, my blood pressure is 130 over 90, but in the afternoon it's 120 over 80. So now we can say, okay, so what are you doing in the morning that is causing your blood pressure to be
Drinking
high?
that
Maybe
orange juice.
either that or a lot of times they're not understanding how to take their medication.
Hmm.
So they're taking it wrong, and then or they're not reading the directions clearly. So they're taking it either in the morning when they're supposed to be taking it at night, or they're taking it at night when they're supposed to take it in the morning. So then we can find a connection of why your blood pressure is increasing.
Right. Yeah, that's so true. And it's so important, I think, too, also, a lot of people everyone is not going to be at 120/80 for their blood
Right.
pressure. And I think it's important that people find out what is your particular baseline blood pressure, because everybody is not going to be at 120/80. Yours may be naturally slightly lower. The next person
Mm-hmm.
may be naturally slightly higher than that. So if it's, normally low, and then you go to the emergency room and they read it at 120/80, to them, they
Mm-hmm.
think, oh, that's normal. But it's not normal for you. It's actually high for you. So I
Right.
think a lot of people need to definitely find that out as well.
Correct. Because a lot of people, their blood pressure could be high and they'll say, well, I feel fine. And that could be
Hmm.
their norm, because when we create our care plans for a patient that have high blood pressure or heart disease, we tell them make sure that your blood pressure is below 140/90, because that could be their range. They might,
Hmm.
a lot of times their blood pressure is 136/80 or 132/80, and to them, that's fine.
Yeah, that's true. How do you all make sure that everyone is following the care plan that you give them? Because once they leave that office, that's
Yes.
it. They don't want to do anything else.
So, we make sure that we do care plan updates.
Hmm.
So we do them probably every 6 months, and we try to contact the patient, go over the intervention and goals, and see if they're meeting their goals, how they're doing. We also have 24/7 access to their charts. So when they're not in the office, we're able to look at their vitals to see if they're following with their goals, if they're doing what the doctor's telling them to do, if they're being compliant with taking their medications. And
Hmm.
then if we notice that they're not doing that, then when they come into their next appointment, we'll call them and say, hey, Mr. Smith, we noticed that after going over your care plan, your blood pressure is still high, or your glucose levels are still high, or your cholesterol is still high. So next time you come to your appointment, do you mind if we meet so we can kind of see where the disconnect is?
Hmm. And you all also work with patients who suffer, like arthritis is included in
Mm-hmm.
that chronic care management, and HIV, AIDS. So does the protocol change drastically depending on which chronic condition that person has?
No, not really. We try to provide care for all of the chronic conditions that the patient have, and try to make sure that we're performing a plan of care for each patient. It doesn't matter the chronic illness, long as that those patients are making sure that they're doing what they're supposed to do at home, and they have two that qualify them for the program.
Okay. And it has to be two.
Mm-hmm.
Oh, okay. Nice.
Because
Oh.
sometimes they'll come in and they only have one chronic illness, so that won't qualify them. So if they have two that's lasting more than 12 months, then that's when they'll qualify for the program. So some chronic illnesses that will qualify them is arthritis, high cholesterol, hypothyroidism, diabetes, chronic pain if they're having a lot of pain. What else? Anemia, Parkinson's disease, any type of
Mhm.
chronic illness.
Have you been seeing positive results with the Parkinson's disease, or I mean any of the other chronic conditions? Do you typically see improvements with the people who kind of stick with the care plan?
Mhm. Yes. We see a drastic improvement to people that are sticking to their goals and what they're supposed to be doing, and following the provider's directions.
I know it's better too once if they have a support system as well, like a nice support system at home, that they can help them make sure that they're managing their medications properly, and that they're doing their exercise every
Mhm.
day, and just doing everything that they need to do to kind of keep it moving.
Yes, having a caregiver, someone that is a family member or a good friend of the family or someone that you can depend on that's always there to make sure that you're taking your medications correctly, that you're making sure that you're going to your doctor's visit as scheduled. They are big helps to reducing chronic illnesses.
Yes. So, people with arthritis, what do you guys recommend for my arthritis people out there?
Ooh, so arthritis people, they really don't need that much help unless they're needing PT or OT. I'm sorry, my daughter just walked into the
No, it's
room.
okay.
They're needing PT or OT to because a lot of times their joints are stuck. You know how that is with arthritis, or when it's getting in the winter seasons, they're having a hard time with their arthritis. I'm so sorry.
That's okay.
They're having a hard time with their arthritis. So a lot of times we try to make sure that they're please close the door. I'm so sorry.
That's okay. I'm a mom. I know how that is.
We try to make sure that, like I said, they're receiving PT or OT, or they're making sure that they're exercising and moving their joints as they need to. We make sure that they're, if they can't exercise at home, we probably refer them to a program that COVID is going on, so we haven't been doing that a lot. But we refer them to either exercise programs, try to teach them how to watch their diets, so that they're eating certain type of foods that can increase bone strength.
Mm-hmm. So, how has COVID affected you guys during this, time, and affected the patient's ability to kind of get better through your management program?
To be truthful, with the older patients, we really haven't had an issue with COVID because they've still been coming into the office.
Okay.
So we really haven't had an issue, to be truthful.
Well, that's good. That's a blessing.
Mhm. But a lot of times we're using the phone to contact the patient. So if they feel like they don't want to come into the office, we can still provide education over the phone.
Mm-hmm. Okay, that's nice. Do you all do like telehealth and all of that good stuff too? Okay.
Yes.
I wish I
Yes.
could do chiropractic through telehealth.
Yes. Yes. We're doing telehealth and having patients come into the office as well if they feel comfortable.
Mm-hmm. Nice. Do they have to like double mask it up now?
Yeah, well, the staff do. Well, right now, we're wearing masks and we're doing a questionnaire, a COVID questionnaire. So we're asking them, are they having certain symptoms? And if they are, then we offer them telehealth or parking lot telehealth.
So talk to me about the parking lot telehealth. What does that consist of?
So the parking lot telehealth is the patients are still booking an appointment, but they are driving to the office and having someone bring out a iPad out to them, and so it's basically they're doing FaceTime with the provider in their car, or they can do it at home.
Wow. I didn't
Mhm.
know that existed.
Yeah, so say that the provider needs them to come inside and drop off a urine specimen or whatever type of specimen. They're able to do that if they don't feel comfortable with coming inside. But if the doctor says, you can come, if they say no to the COVID screening questions, and they don't feel comfortable, but they feel comfortable to drop off a specimen, then they can do that.
Yeah. Okay. That's
Because
nice.
some people don't want to come fully into the office. They want to come like to the front desk and drop off what they need to drop off and then run out. So it's all the patient's preference.
Well, that's nice that you guys give them options,
Yes,
when they
yes.
come in there, when they come in a chiropractic office, it's just do your paperwork, sign in. I'm just risking it all back there.
Right. No, no, we're taking precautions down here because we're in Florida, so it's crazy down here. So we have to take strict precautions for all patients.
So if a patient is coming to you for chronic care and they
Mhm.
did test positive for COVID, what is the time frame that they have to wait before they can actually physically come into the office? Or do they just have to have a negative test?
So if they test positive for COVID, they have to wait 10 days in order to come into the office. The good thing about our office is we provide the patients with parking lot COVID testing on Fridays. So they
Mm.
can just drive up and come through the parking lot and do a COVID test. So the only way that they are able to come into the office if they show proof of a negative COVID screening within the 10 days.
Mm.
So if they are positive for COVID and then after their 10 days of quarantine and they go through the parking lot and they have a negative test, then they're able to come into the office. But if they don't show proof of a negative test, they're not able to come inside. They'll have to do the parking lot or do telehealth at home.
Oh, okay.
Mhm.
So, Felicia, how did you get into chronic care management? Like, that's not something like when we're in school, it's not something that you really hear about. You know what I mean? So, like many other specialties. So,
Mhm.
how did you get involved in chronic care management?
Well, before I started working at my job, I was working in the public health department over the entire peace department for a nonprofit agency where I live. So we lost our jobs due to COVID. So when I seen the opportunity on Indeed for this job, that's when I applied, and then they told me, they have the chronic care management program, what it was about, and I became interested into it because it was dealing with public health, basically with providing the patients with resources and education.
Hmm.
So that's basically how I got into it.
Nice. So,
Mhm.
outside of the like what all resources do you offer? I know you said if they need a referral or if they need, medical like medications, the therapies for the patients that have arthritis.
Mhm.
Are there any other resources that you guys offer?
Yes, we provide information with resources with people in the community that provide transportation. So a lot of times, a lot of people don't know is that their insurance provides transportation for free. They just have
Mm.
to the care coordinator just has to contact their insurance and book a transportation for them 48 hours in advance. So their care coordinator can do that for them. We provide resources with home health. We fill out SCAT applications for the patients, which is the public transportation. If they fill out an application for basically it's like reduced income, that they have reduced income, they are able to ride the SCAT either free or at a reduced cost.
Mm.
We do the handicap applications for the patients. We provide them with resources with filling out the SNAP benefits application. A lot of times patients have Medicare, and Medicare doesn't cover the entire cost for medication coverage. So they have an income eligible program where oh, I can't think of it at the top of my head, but basically the medication company will provide assistance for the patients
What?
to cover the cost for their medications. I'm sorry, I couldn't think of,
No,
but
it's okay.
they'll cover the cost for their medications. We also provide resources for housing. A lot of times we can provide rental assistance where places are providing rent coverage or security deposit coverage. We provide resources for in the community where they're paying for patients lights and water. So any resource that they have, we just want to make sure that they know about these things that's in their community.
Wow, that is so
Mhm.
awesome because
Mhm.
there's so many people that need, all of those resources from the housing to, the transportation. Like it's so many people that need that information.
I
So
think a lot of people don't, they're not aware of all the resources that they have in their community because it's not being provided to them. So that's when care coordination comes in and say, hey, I see that, because they'll call and say, I'm on a reduced income. I'm not able to do this. I'm not able to do that. So that care coordinator can say, hey, well, do you know that this place is providing funding for rent assistance? Did you know this patient is providing funding for security deposit? Did you know that this company provides funding for your medications? And so they're kind of surprised, like, no, I didn't know that. I didn't know that I could do that. And we're like, yeah, yes, all
Mhm.
these resources are available right in your area.
Yep. And one of the challenges is a lot of people don't know exactly what their health insurance covers and don't cover. And then they come in
Hmm.
the office and they want to snap because they thought their insurance covered certain
Right.
services. And, that's why I always try to tell people, like, all you have to do is go on the website, look up your plan, and see exactly what is covered and what is not covered
Correct.
under which specialty, etc. So you'll know before you get in the office and you want to cut up because you thought something
Right.
was covered. So we
We
get that.
also provide resources for patients to get free DME,
Oh,
which is
nice.
during medical equipment
Yeah.
for their homes, like Hoyer lifts, wheelchairs, ramps for their home, anything that they're needing. We just send an order over to the DME supply company, and Medicare covers certain things.
That is so awesome. I'm
Mm-hmm.
excited. So if you guys are in Sarasota, Florida,
Right, we're in Sarasota, Florida.
you have resources out there. And you know what? There are actually a lot of programs like that here in Alabama. I know for sure in the Black Belt, a good friend of mine, she worked with a company where they would actually help with, in the summer, they would help with the electricity bill, the cooling and
Mm-hmm.
stuff like that. And then in winter, they would help with, the gas bill.
Mm-hmm.
So just to kind of give them, a little break, and especially with COVID and all that stuff. But one of the challenges that we have, because, in certain parts of Alabama, they call it the Black Belt, a lot of people who are getting these funds are misusing those funds, and they're not
Right.
really distributing it to the clients who really, really need it. And they're kind of pocketing it or giving it to their friends or their cousins and stuff like that.
Mm-hmm.
So that's definitely something we have to really take control of in the Black Belt. And I think we have to get better regulations so that these resources can be used to the population that really, really needs it.
Yes, that's very true.
Yeah. So do
That's
you all
very
kind of have an issue like that in
No,
Florida too much?
no, we don't no, we really haven't ran into that issue because of, it being Sarasota. I don't think a lot of the patients that are enrolled in the program know about resources
Mm-hmm.
that are covered through their insurance, so when we tell them, they're kinda shocked. So
Mm-hmm.
I don't even think that they would know to go as far as go as far as knowing about money that's available to them.
Yep. Well, is there anything, what do you want the general public to know about chronic conditions?
Um, the what I want the general public to know is maintaining a quality life is very important, because when you get those chronic conditions, if you're not taking care of yourself, they can become very worse.
Mhm.
And a lot of times the chronic conditions can be maintained if you're doing what you're supposed to do, as far as taking your medications, exercising, eating a healthy diet, making sure that when you're going to your doctor's visit, if you're not understanding certain terms that the provider is using, ask them to break it down so that it can be to your understanding. Because a
Mhm.
lot of times people go to the doctor and the doctor says what he has to say, and they walk out and they're confused on what the doctor is informing them about their diseases or chronic illness.
Yes.
So just asking for clarification on, okay, when you say this, what does that mean? How do you want me to take this medication again? Am I supposed to take
Mhm.
it in the day, in the morning? Don't just leave and say, okay, I understand. And then when you get home, you're confused,
You're
because
like,
at the
"What?"
end of the yeah, like, oh, when was I supposed to take it? How was I supposed to take
Yeah.
it? Because at the end of the day, your health is important.
Yeah.
Your health is very important. And so I think that it's good that they have care coordinators or chronic care management departments in the offices, because if they're not understanding something that the doctor is saying, that chronic care coordinator can provide more information on that illness and say, okay, let me break down what is high blood pressure, how it works. Let me break down diabetes, how it works. Let me break down cholesterol and how it works to that person's understanding.
Yeah. Well, Felicia, I just want to say thank you so much for joining us tonight. I'm so excited. If anything, you guys, if you have not gotten anything else from this show tonight, definitely, if you don't understand something when you go to see your medical provider or PCP, ask them, because I get so many patients that go and visit their doctors and they have no idea what surgery has been done on them, what
Right.
medications have been prescribed to them. They don't know what's going on with their health. They don't know anything. And if you don't understand or if you don't know, take somebody with you who may have an idea or who can help you find or research what is going on with you.
Exactly. It's
So
very important.
very important. Well, okay, you guys, thank you so much for tuning in tonight. Uh, I have so many things. I'm like, I can't even get it all out. So one thing I want you guys to be on the lookout for is I am working on developing a scholarship, putting together a scholarship through my nonprofit. And so this scholarship will be for Black or Hispanic young girls who are graduating from high school and they are looking to pursue a career in healthcare. So stay tuned every week. Once everything is finalized, I will upload the link so that people can start submitting their applications and all of that good stuff. So I'm very excited about that. So make sure you guys tune in every Monday night at 7 p.m. Central Standard Time. I am so excited and I will see you next week. Bye, guys.
Bye.